Disease 2019 COVID-19.
Dr. Rosa, when you're ready. Just hold on 1 second, make sure we're here. Yeah.
I'm kind of out of practice. This is my first time back in a long time in person.
Welcome back.
So it's good to be here. This morning's briefing topics will include our update on COVID-19 data, an analysis of our 0 to 18-year-old cases, sharing with your board the health officer order for indoor masking, more information on the flu season, and it will end with Mr. George Chappian and the legal aid giving an update on COVID-19 eviction moratorium. Santa Barbara County by the numbers. Currently, we are reporting 34 new cases. This is about a 62% decrease from a 2-week average. Active cases at 356. Our total cases in our county is 42,590. Case rate as of September 30th is at 11.5. Unfortunately, we reported a new death. This occurred to a resident who lived in Santa Maria in the 30 to 49-year-old category. We currently have 44 hospitalized, with 17 of them in the ICU. So with regards to ICU numbers, we are seeing an increase, about 42% in the last 2 weeks. Total death in our county is 505, and our testing positivity as of September 30th is at 3.3. With regards to hospital capacity, as of October 4th, we have 38% remaining hospital beds and 31.2% of ICU capacity. So this is typical. It's something that we are gauging, and we are in conversations with our hospital partners. And when we look at COVID-19 hospitalization data, we are sharing the differences between the number of unvaccinated and the vaccinated who are hospitalized. So the number from May to August, we had 306 individuals hospitalized for COVID, and 85% of them were unvaccinated, with the remaining 15% fully vaccinated. And this is reflective of trends that were throughout California and in other areas of our country. Vaccination rate, we are inching up our vaccination numbers. We are reporting a 68.9% of eligible Santa Barbara County residents as fully vaccinated. I'd like to share with your board the vaccination rate by zip codes, because it's important to look at the wins in the areas that we have been outreaching, partnering up with community leaders to reach. There are the highlighted areas. So that signifies the 6 zip codes in the Mid and North County that have made a greater than a 0.8% change. So every one person that vaccinate, we celebrate. To put it more succinctly, the greatest percentage increase from previous week is observed in this graph. So we have 4 zip codes covering Guadalupe, New Cuyama, Santa Maria, Sisquoc, and Gary that in the first column, percent change among partially vaccinated, experienced 0.92 all the way to 2% increase in the number of people who got their first shot. The last column, the orange column, signifies a percent change among fully vaccinated, So again, we're seeing a range from 0.9 to 1.4. And so Guadalupe is our star this week because of all the community outreach and partnership making it happen. And the next would be New Guayama. This graph shows the traction that our mobile vaccination program is making throughout the county. This past week saw our largest increase in the past 2 months, with a total of 294 vaccines at 5 clinics, 2 schools in Goleta, 1 school in Orchid, 1 supermarket in Santa Maria, and an ag site in Santa Maria. So we are seeing successes with the smaller vaccination opportunities in various neighborhoods and in various communities. Current outbreaks. We are reporting 36 active outbreaks, 5 among businesses, 19 among schools, and 12 in congregate living facilities. I'd like to share with your board our analysis of cases among 0 to 18-year-olds. The case data was analyzed for this age group who reside in Santa Barbara County. In the 18 months, starting with March 14th, 2020 to September 23rd, 2021, we are reporting 5,893 COVID cases among the 0 to 18 age group. As you can see from this graph that captures the cases throughout the 18 months, the cases by episode date follow very similar trend as we saw in other age group, with peak cases during the winter months. The summer peak of 2021 was higher than the summer peak of 2020 among 0 to 18-year-olds. And interestingly enough, for the same time frame, we saw currently in this current surge a high of 43 somewhere around September. Comparatively, a year earlier, it was only 11. With regards to gender, it's pretty even with 2,951 cases in males and 2,924 cases among females. So pretty much an even split between males and females. With regards to race and ethnicity, we are reporting 3,783 cases in the Hispanic, Latino children, 841 in whites, 682 were missing, 333 were unknown, 80 from the Asian American community, 7 from the multiple races, 48 categorized as other, 7 in the American Indian Alaska Native, and 7 in the Native Hawaiian or Pacific Islander. It's noteworthy to point out that children in Santa Barbara County are more likely to be Hispanic and Latino. This graph describes the 0 to 18 cases by region, and the top 3 are from the city of Santa Maria with 2,012 cases, followed by Santa Barbara at 1,034 cases, and lastly, city of Lompoc at 792 cases. So in summary, the 0 to 18-year-old cases by episode date followed very similar trends to the pandemic, with peak of cases during the winter months. The summer peak of 2021 was higher than the summer peak of 2020 among this age group. And the majority of this age group were Hispanic and Latino. However, as I pointed out, most children in Santa Barbara County are Hispanic and Latino. Most 0 to 18-year-old cases reside in Santa Maria, followed by the Santa Barbara and then Lompoc. I'd like to, before I share with your board our health officer order for indoor masking, I'd like to just share with your board are multiple layers of protection and the thinking around that. So this is the Swiss cheese model, and it shows us key to any good prevention strategy is layering. So while there are holes in slices of the Swiss cheese, by combining the slices, we get a layered approach that leads to fewer holes. This is true for the COVID-19 prevention strategies. The strongest protection comes from getting vaccinated. Protection comes from wearing a mask, physical distancing, washing hands often, and having good ventilation in indoor spaces. Each of these are important ways to reduce risk of getting COVID-19, but become really highly effective when one combines them. To go a step further from this model, we've added the misinformation mouse. It's a cute little icon, but it drives home a very serious point. Misinformation is endlessly harming to the widespread adoption of the layered prevention strategies. Just as this mouse eats away at the cheese, so too does misinformation erode the confidence of the public in proven prevention methods, such as masking and, of course, vaccination. Misinformation Mouse is working constantly to break down our Swiss cheese prevention layers. The only way to prevent it is to stick with the facts offered by established, reliable sources of information, such as the CDC, CDPH, and additionally, our local public health sbc.org site. So as a reminder, when heading out to work, to the store, when around others, remember to safeguard yourself and your loved ones and your community with multiple layers of protection, such as vaccination, practicing physical distance, wearing a mask, washing hands often, and ensure good ventilation in indoor spaces. So with that, as I mentioned, wearing masks indoors is a layered approach that will safeguard our community. We first issued our local health officer order 2021 10.5 in August 6. And it is because since the lifting of restrictions on June 15th, the average daily incident case of COVID-19 in our county started climbing and climbing and climbing, reaching the category of high transmission level based on CDC's standards. Significantly, also was a Delta variant circulating at that time in the US as well as in our community. So to control the spread of COVID-19, this health officer order was issued requiring all individuals in the county of Santa Barbara, whether vaccinated or unvaccinated, to wear a face covering at all times in all indoor public settings and businesses with very limited exemptions. So we are encouraged that let me go back. Oops. I am needing to. So we are encouraged, as you can see, the trend is downward. And so we are very encouraged by that. And so what that means is that we have renewed the Santa Barbara County Health Officer Order for indoor masking until, we've renewed it today, and it will be in effect until November 5th. The health officer order will be lifted when case rate is less than 6 per 100,000 for 2 weeks. However, masks, we want to remind the public that masks would still be required in certain settings per state health officer order and per Cal OSHA guidelines. So these would be the schools, the healthcare settings, as well as congregate living centers. The triggers that will cause a reissuance after we lift it would be us experiencing another high surge of high case rate over 2 weeks, and concerning circulating variants, as well as dipping hospital capacity. As we mentioned earlier, and great appreciation to your board for allowing us to kick off the flu season. As I mentioned earlier, walk-in clinic or by appointments, community members can go to myturn.ca.gov to see where they can drop by and get a shot or by appointment. And it is the best option to preventing the flu. I'd like to end with great appreciation and gratitude to your board for your unwavering support of public health and our community partners in all of our attempts throughout these past 18 months. In particular, I also would like to thank our various community partners for their support when we go out into the community to vaccinate. And I do believe that because of our community partners linking arms to get everyone vaccinated, we are seeing traction and we are seeing increases in hard-to-reach communities in our county. Thank you. And with that, I don't know if your board would like to entertain questions or I should pass it over to Mr. Champion.
Any questions from the board? Supervisor Williams.
I guess it's not exactly a question. So things in terms of the leading indicators are looking a little bit better. I'm sure our numbers for Saturday and Sunday weren't quite as good as Monday. That's typically the way it goes. But it's still, we're still have cases and we still have deaths even among younger individuals. You know, and I think, you know, some people are already asking about the mask thing, and I'm sure that's why you addressed it today. But I think, you know, generally the collective philosophy of this board, I would have characterized as, you know, we would like the less invasive solutions to prevent the greater problems. And so masking seems about the least invasive thing we can do when people's jobs, lives, and businesses are at stake. So I think we still want to treat the whole matter with a great deal of caution and appreciate that that's the attitude of public health.
All right, any other questions from the board? I have a couple. Slide 18, can you bring that back up for a moment? So, just so I understand that, is it left to right on the effectiveness, or could those be in any order? Or I didn't know if it was any purpose in particular.
They're not in any order, so it was
Okay.
just a demonstration of each strategy layered on top.
I understand, I just wanted to clarify for my own purposes. I know we mentioned when we went into the mask mandate was in part because we were at the high transmissibility status according to CDC. Are we still in that? According to CDC? I know they have they don't have the color scheme like we have in California, but according to, are we still in that status within the CDC? Or what is our current status?
We are in the high transmissibility status still because we have more than 7 cases per 100,000 residents.
And I guess that was my other question was, where did the 6 out of the 100,000 come from as a number? Is that arbitrary, or are you guys taking that from something in particular? I think it'd be helpful.
It's a middle ground. The CDC has the cutoff at 7, and the old blueprint was somewhere 4. So we were picking a middle ground.
All right, and then as far as the 18-year-olds were concerned, the 0 to 18-year-old study that you guys did, were you able to compare the percentage per population versus the general population? Are 0 to 18-year-olds getting COVID at the same rate as the general population or less?
No, we didn't look at that, but we certainly can do a comparative at the next board meeting.
All right, and just for the public, this is going to be one of our latter, or at least for now, going to be our last departmental presentation. This will still be on the agenda as an administrative agenda item, but I would love to see that as well. And And along with that, maybe looking at hospitalizations and deaths among 0 to 18-year-old comparatively to the general population. I think it's good to have that layer of context for those that are concerned. It is definitely serious, but it's a relative seriousness that I think that probably is better explained when we have those numbers.
Yes, so just the process of us getting data, we scrub the data that comes from CDPH is fairly messy, and so our team writes codes to extract the information. And then on top of that, we were going to include hospitalization data, but in looking at the hospitalization data, there were discrepancies between what our hospitals were reporting and what the state was reporting. So we didn't include it this time, but we will come back to your board with a more comprehensive comparison between the 0 to 18 as well as the general population.
Thank you, Dr. Dordos and Dr. Haney. All right. Supervisor Hart.
Yeah, I just want to say what a great graphic this is. I think this really tells the story well. We had a couple of people speaking to public comment, talking about isolated strategies and, what's the effectiveness of this versus that and in what context. And I think this helps at that 40,000-foot level to really explain the need for thinking in terms of layers of protection. And that's, there's no silver bullet to solving any complex problem, let alone, something like this. But I think this really helps the public to understand that, by putting different strategies in place together and being smart about it, we can really reduce the risk of transmission of the virus. And that's the point, to protect all of us together by doing simple things in tandem with each other to maximize their effectiveness. So thanks for bringing this to the presentation. I appreciate the good work.
Thank you, Supervisor Hart, through the chair. And I have to give great kudos to our comms team for this creation. And this is, throughout this pandemic, we all play a part in the risk mitigation. So Dr. Ansorg, with his clinical background, I lead the department with policy and administration, and then we have our comms team, which take what we do and put it into a graphic form so that we can communicate this to various members of our community. And then there are other community members who likes the data and the graph, and we have our data dashboard to meet that need. So it's really, I'm really being in a very appreciative and thankful space this morning, because as I reflect on this being a last meeting for a while, that it has taken all of us with our strengths and our gifts to be really able to link hands and respond to the pandemic in the way that we have. I think that in comparison with a lot of other colleagues, I have colleagues up and down the state, and we compare notes, and they're jealous because we have a wonderful board, we have a wonderful healthcare system, and we have incredible community partners and we're all linking hands, focus on increasing vaccination and decreasing the case numbers in our county.
Right. Yeah, it's a really good point. I can't miss the opportunity to thank the comms team too. They really are doing a fabulous job every day. Terry, Jackie, Gina, Suzanne, and everybody else that's supporting them. Just even this graphic with the little misinformation mouse, it's so cute, that's perfect. That's exactly part of the challenge that we have, is trying to combat consistent, persistent misinformation. And just, folks can just go to the publichealthsbc.org website. They know that information is vetted, it's tested, it is reliable, and it's accurate. And that's, you don't have to go any farther. You don't have to search the internet. You don't have to go down a rabbit hole. Just go to that publichealthsbc.org website, and you get the most up-to-date information that's available.
Thanks, Supervisor Hart. I believe this time we'll go to Mr. Chepchin.
Thank you, Chair Nelson and members of the board. I was asked by a CEO to provide a update on the Emergency Rental Assistance Program through the State Treasury. Oh, this is a legal aid slide. Okay. Can you go? Right there, yes. Which one? Okay, good morning again. Let's start all over again. As you can see, there a lot of money has been flowing through the county, through the state and U.S. Treasury for emergency rental assistance program for our residents. There's an allocation of ERAP 1, they were called ERA 1, ERA 2. As you can see, in the ERA 1 round, the county received 13 million, the state received 14 million. In the second round, combined, there will be another $28 million coming to the county residents for emergency rental assistance. This chart summarizes the funding amounts for each of those, ERA 1, ERA 2. United Way has spent our ERAP 1 funds, rental assistance funds, the 13.2 million, and the state has just closed its application for ERA 1 funds due to a projected exhaustion of funds. The state is continuing to process the applications received before its application portal closed. And accordingly, the United Way just began administering the ERA 2 program and is currently accepting applications online. United Way is utilizing county ERA 2 funds as they are received from Treasury. We'll be getting 16 million total. We haven't received all of it yet. And we'll later expand to include the state's ERA 2 funds. So we did have discussions with the state, and they are willing to allow us to expend their funds for the second round. So I think that's really good news for local residents. This slide shows the eligibility requirements for Santa Barbara County residents. Basically, a rent obligation, which is a lease, history of payments, or landlord letter, an income, 80% area media income, and average median income, and below has to be documented. Households can attest to having experienced an economic impact because of or during the COVID-19 pandemic, and that they are at risk of homelessness or housing instability. At the bottom of the slide is the 80% and 50% average median income charts for household sizes 1 to 4. This slide shows the direct assistance funds from the ERA 1. We do not yet have data for the ERA 2 applications that launched last week. So as soon as we get those, we will update the board on those ERA 2 funds. As you can see, we've served 1,413 applicants. On average, we paid out $8,262 in rent. Over 92% of households were below 50% AMI. 73% of applicants were a family unit. The median household size was 3. And Santa Barbara County residents can apply at the link on the bottom of the screen. Funds are available. There's $16 million coming, so funds are available. Slide 4. Let's see. This is the state program. As you can see, they have, right now, it's almost 2,000 applications, so that number's a little dated, but it's almost 2,000 applications. They spent $4.19 million of the 14 million that they have. So they are going to hold on to this program. They're going to process these applications, and we'll take the second round of the ERA. So they're still processing applications at this point. This slide 5, since SB 91 was passed, the state and our county program have both been paying 100% of rent arrears, current and 3-month prospective rent, and that remains the same with United Way's now live program for the ERA 2 funds. So new with the ERA 2 round of funding is the availability of relocation assistance. Landlords should be aware that ERA assistance can pay for a tenant's moving to a new unit with security deposit, first and last month's rent. So that's. And finally, slide 6, United Way and State HCD are staffing call centers where applicants, tenants, landlords, or courts at their option can check the status of an application. Tenants or landlords that need to confirm the status of an application submitted to United Way should call this number down here, 805-965-8591. Tenants or landlords that need to confirm the status of an application to the state HC, Housing Community Development, should call 833-430-2122. And that concludes the update on the ERA funds.
Okay, any questions for Mr. Chapchin before we go to our next presentation? I have a question. So this program takes an affirmative action from both the tenant and the landlord, or to be eligible for the rental reimbursement?
Yeah, I think it reimburses the landlord at most cases. So it's they're directly working with landlords to pay the rent,
Okay. And
if
so,
that's what you were asking.
yeah, I guess my question
Yeah.
goes with, there's a tenant who, their landlord hasn't taken advantage of this program.
The tenant can apply.
The tenant can apply on
Yes.
behalf of their
Yes.
landlord.
Yes.
So
Yeah.
those both options are available. So
Yes.
okay. All right, thank you. All right, Supervisor Hart?
Yeah, I just want to thank Mr. Chapchin for that presentation. I want to thank United Way for all the great work that they're doing in partnership with the County of Santa Barbara. They are really a trusted messenger, an organization that's there, ready to help in a crisis. And, the good relationship that we have with United Way, predating the COVID-19 pandemic and their assistance in providing support for renters is a really important resource and an asset for the County of Santa Barbara. And I just want to encourage us to just stay close. That is really, I think, if there's anything at all, that there's a silver lining to the pandemic, it is the new tested relationships that we have with the governmental the nonprofit organizations in the community that do direct services to local residents. And United Way is right at the top of that list. And the Legal Aid Foundation of Santa Barbara County is also right at the top of that list. So I asked Jennifer Smith to join us today to give a little bit of information about what it is that Legal Aid is doing to help protect renters in this very difficult environment, with the statewide eviction ban ending on this past September 30th. The information that Jennifer is going to share with us today is even more important. The Legal Aid Foundation is a really important resource to tenants and landlords both, because there's a collaborative relationship there. They're able to help folks navigate this complex space and provide assistance to both landlords and tenants in a way that works best for everybody. So with that brief introduction about what we're going to hear, I really want to thank Jennifer, the Executive Director of Legal Aid, for joining us today. Thank you for coming.
There we go. Thank you very much. Good morning. My name is Jennifer Smith. I'm the Executive Director of the Legal Aid Foundation of Santa Barbara County. Thank you for having me today. And just a reminder that this presentation is for general information only. It's not considered legal advice. Anybody, whether you're a landlord or tenant, facing any legal questions is strongly encouraged to seek their own legal advice about their own specific situation. So just a reminder about who we are. We are a nonprofit law firm, and our mission is to provide high-quality civil legal services to low-income and other vulnerable residents in order to ensure equal access to justice. So, in a nutshell, right, if you're charged with a crime, you're guaranteed the right to an attorney. But in the civil world, you can be facing eviction and you're not guaranteed the right to an attorney. So we do our best to try to meet that legal gap. And our offices are in Santa Barbara, Lompoc, and Santa Maria. Just a general reminder about various different things we do, just as a reminder, but today we're focusing on housing and evictions. So it's important to remember that eviction is a court process, and this is actually something that's often misunderstood. In order for somebody to be legally evicted, there has to be a court order. So just because a landlord says to somebody, hey, you need to get out of here, you need to move, that's not a legal eviction. So in order for an eviction to take place legally, there has to be that court order. And there's a general process that unfolds. So in this context, in terms of talking about payment of rent, the first step that typically happens is an eviction notice that a person will receive. That notice is called a notice to pay rent or quit. Through the end of September, that was a 15-day notice. Moving forward, for rent owed moving forward, it's a 3-day notice. But that puts the tenant on alert that rent is owed. And the next step is the actual eviction lawsuit. So, so then the parties go to court, and then a judge decides, whether or not an eviction takes place. We're very lucky in Santa Barbara County that before the judge makes an order, we require a settlement process and discussion to take place between the parties. So as much as possible, we hope that the dispute can be resolved before going to trial, but if necessary, the matter does go to trial. There's a court order, and then the final step is the actual physical eviction. So that's enforced by the sheriff's office. They enforce the court's order. They go out. They also issue a final notice and enforce the court's order. So in terms of where we are now, it's important to highlight what protections we previously had in place in order to understand where we are now. So through the end of September, there was a protection in place for people who owed rent. And so if they owed rent from March 1st, 2020 forward, they could submit a declaration to a landlord, a declaration stating that they have experienced some version of COVID-19 financial distress. And so during this time period, if the tenant returned that declaration in a timely way, various protections kicked in. So for the period for rent that was owed between March and August of last year, if the tenant submitted the declaration, they could never be evicted for failing to pay that rent. So they could still be subject to a debt collection lawsuit for that rent, but they couldn't be physically evicted for that time period. And then for the period of September 2020 through September 30th of this year, if the tenant submitted that declaration, they couldn't be evicted. And then if the tenant paid 25% of rent owed during that year-long period, again, they could never be evicted for failure to pay the remainder of the rent. Again, they could be subject to a collections lawsuit, but not physically evicted. And so where we are now, as of October 1st, the state's eviction moratorium has come to an end. So this process of submitting a declaration of distress has ended. And so if a tenant didn't pay that 25% of rent due for the last year, it's possible that they could be evicted now for failure to pay rent, and or if they owe rent moving forward, those normal processes go back into place. And again, most of the normal, pre-COVID eviction laws are back in effect. However, there is sort of this transition period where there's still actually some procedural protections at play. And that runs from October through March of next year. And basically, it's a temporary court process. And so the key components are that we are returning to this 3-day notice to pay rent or quit moving forward. But in order for a landlord to proceed with that eviction lawsuit, they need to demonstrate that they've cooperated and sought rental assistance before that lawsuit is allowed to proceed. And so this modified court procedure applies if the landlord is filing the lawsuit based on a tenant's failure to pay rent anytime from March of last year all the way through the end of March 2022, and the tenancy was already established as of October 1st. So basically what this really means and really emphasizes is that rental assistance remains absolutely critical. It's still available today. And, I think the state legislature really made an effort to say, look, we have been through a global pandemic. We want this rental assistance to get out. We don't want people to be penalized because this global pandemic happened. we really want to guide everybody to apply for and seek that rental assistance. So, and just some acknowledgements in terms of the various entities who helped me with these slides. And I welcome any questions, if any.
Thank you, Ms. Smith. Supervisor Hart.
Well, I just want to thank Ms. Smith for that great presentation. It really helps explain how the interrelationship at the end of the statewide eviction moratorium with this new period of time that gets out to March 1st, 2022, and how the rental assistance program that we're still using and allocating funds through United Way, how those fit together and really do provide a level of protection to tenants that if they can make themselves available or take advantage of these programs can really make things better for them and their families. So thank you for coming today, and thank you for sharing this really important information with the community.
Thank you, Supervisor Hart. Supervisor Williams.
Want to thank you for being here, and that was very cogent. You know, can you take the opportunity? I know because they're a charter city, you know, Mr. Hart and myself represent the city of Santa Barbara. They have some additional protections because they're a charter city. Can you give that out in a little bit of information, mainly for the benefit of our staffs who are right now dealing with a number of tenant issues and trying to lead them through the process?
Yes. So broadly, the city of Santa Barbara does have some additional. Generally speaking, most eviction law is governed by the state of California, and then local jurisdictions can be more protective or provide additional rules and regulations in that arena. And in our community, city of Santa Barbara has several of those. So there is. And I can also respond with more of the details, but in general, there is a relocation assistance that's required in the eviction context. There is protections also for requiring a reconciliation or mediation process before the eviction lawsuit proceeds. And there's also some rules about leasing agreements and written leasing agreements. So there's a couple of added layers of protection for City of Santa Barbara residents. I think with an eye towards what this pandemic has really demonstrated is just how dangerous housing instability can be. And so I think the city's protections are trying to tackle and address additionally those instability issues. And I can follow up with further details on all of those, but in general.
Thank you.
Yeah.
Thank you, Supervisor Williams. Supervisor Hart?
Oh, I'm sorry, I just had my mic.
All right. I had a few questions for you, Ms.
Yes.
Smith. So what would make a tenant or landlord ineligible for rental assistance?
If the family income were above the 80% AMI, they may not, it's possible that, they wouldn't be eligible. There's also just, right, there's an incredible amount of dollars available, but as we saw in that round one, the funds may end up being exhausted at some point. So there's a possibility that there could be more applications than funds allow. So they could be denied just once the program funding runs out. And, the family has to demonstrate a COVID-related hardship. But, that, I think sometimes people are misinformed. They think, oh, I had to have COVID, or like I had to have a family member have COVID. But, it could be that your hours were reduced at work, or, you had a furlough, or
Childcare, yeah.
Childcare, right? So many people had to stay home in terms of the school issues. So those are all things that can qualify you.
Right. Well, actually, let me ask Mr. Chapchian for a minute. So, because there are people being rejected from the program, I imagine, or that are applying. Is income tend to be the leading determination on that?
Chair Nelson, yes, it is. It's 80%, and sometimes it goes down to 50% AMI.
On the program?
Yeah. So it basically is income if they've been impacted by, and it's self-attestation too. If they've been impacted by COVID, they lost a job or reduced hours, as she was alluding to.
Is the income portion a self-attestation as well? or is it just the hardship portion?
I have to double check on that. I think they have to, I think that's not just self-attestation. I think they've got to prove that.
All right.
Yeah.
And then a couple other quick questions for Ms. Smith. So if somebody's paid 25% and now it's October 1st, is there a landlord allowed to require them to pay arrears first before they start paying their October rent? Or is it a new line moving forward? Or is that unclear?
Yeah, it's, it gets a little, it gets a little complicated in terms of how that applies. But if they have paid that 25%, they can't be evicted. So typically, if you've covered yourself and you can pay your rent moving forward, that tenant will be protected.
All right, thank you. And I guess my last piece is just a comment is that, I've seen over and over throughout the pandemic, landlords and tenants working together.
Yeah.
And I would encourage anybody in the public who's in hardship, if you haven't had the conversation with your landlord, have it. If there's a landlord who suspects that a tenant's having a hard time, have that conversation. I think we can do a lot more through dispute resolution than the legal process if necessary. So I want to make sure that is said moving forward here on this. So thank you, Ms. Smith. I believe we still have public comment on department item number 1, but Supervisor Williams?
Well, I just wanted to also, I asked Dr. Ansorg a question that we all got emailed this morning about drinking water fountains. And so after public comment, I just wanted to make sure he let us know the answer publicly so that people know that what the issue is.
All right, thank you, Supervisor Williams. So this time we'll go ahead and go to public comment. Madam Clerk?